We have our first question from a viewer from Canby, Minnesota. So that viewer gets the honor of being the first 2015 question. This viewer wants to know about wage increases for long-term care workers in nursing homes and group homes, and specifically directs this question to the Republican members of our panel. Let's start with you, Representative Pepin. Well, how does that issue play in this session?
I think it plays well. Our caucus is certainly dedicated to looking at those aging issues. And I can tell you a personal story. My mom was in a nursing facility, and I know every time I went to visit her, one of the things I thought about is how much money is this person getting paid. And when you consider what they're getting paid, and you consider they're taking care of your loved one, you really start to wonder if we're doing right by our aging population. And last year, I know our caucus put forward, I think it was Representative Franzen, put forward a 5% increase on nursing home reimbursement, and I believe it got pulled out in conference committee, unfortunately. But our caucus also supported I think we gave a small COLA increase last year, and I think it's something certainly that we need to keep working on.
Representative Marquardt?
Well, in fact, the DFL majority did increase nursing home funding 5% for the first time about 5 or 6 years, and increased personal care attendance by about 6% after several years of cuts. And we hope that continues. The increases there, as Representative Pepin mentioned, that is very difficult work. They take care of the most vulnerable, our loved ones, and it's dollars well spent. And, in rural Minnesota, where you have an aging population, it's extremely vital that you make sure you pay those very valuable workers, what they're worth to be paid.
Senator Bach?
Well, we did some very heavy lifting last year. There was a campaign for the community-based services that came to the legislature and asked for a 5% increase. We had done, I believe, 5% to nursing homes the year before. An additional 5% to the community-based services, the people that deal with in-home health care and people with disabilities in community settings, costs about almost $100 million a year to do that. And this year they came to us and they want not only 5% for the biennium, they want 5 plus 5. So that would be, we're already giving them $190 million more in this biennium than we appropriated in the last one because of the 5% increase last year. And I think, and I'm very, very sympathetic to this, but I think if people think they're going to get 5% and 5% in this budget cycle, they're probably going to end up disappointed. And it is a priority for me, but there are a lot of other spending pressures in the budget also. So we're going to do the best that we can with the money that we have. I guess we'll find out when the February forecast comes if we have more money or less money to work with. But I know $1 billion sounds like a lot of money, but in the context of a $40 billion state budget for 2 years, it's a pretty razor-thin margin, and even a small hiccup in the state's economy can erase that very quickly. So we're going to do the best we can. I tell you, it will be a priority for the Senate to try to find some additional money, especially for nursing homes. The little town I live in, and especially for rural nursing homes, we have lower reimbursements. The little town I live in is one of those, has a hospital nursing home combination, and it's the largest employer in the community, and it's absolutely critical infrastructure for those families that have loved ones there. So we're going to do our best to make sure that no additional nursing homes close, because I don't want to be the one responsible for not paying close enough attention and having rural nursing homes closing.
So, Senator Hahn, and when we're talking about this, when Senator Bach mentions the razor-thin margin, my understanding is that $1 billion does not include inflation. Am I right about that?
Well, I think...
Or is that oversimplification?
Well, no, there are some programs we have in the budget that do have an inflation factor built into them, but generally we've had a debate over the years about whether we ought to put into our forecast a sort of inflationary factor for spending. And Republicans have argued generally not to do that, that when we come in every year we have to look at what the spending is and what the needs are and do the right thing as much as we can afford to with the resources we have. There's been a debate about that, but as I understand it right now, the budget forecast does not include that automatic inflation number. I think for a while we did have it back a few years ago, but we don't have it now. So there's always that concern that things are going to cost more, and I think Tom is right. We did do a 5% campaign last year. It's very broadly supported by both caucuses in the House and the Senate. I think there's an interest, and I think our caucus certainly wants to do as much as we can to help the nursing home workers and others doing long-term care. It's just a question of how much we can afford to do, but I think there's strong interest to try to do the best we can.